Good afternoon, everybody. I think we're still waiting for a few people to log on, and then we'll get going. So just give us a few minutes. Thank you. Okay, good afternoon, everybody. Welcome to this lunchtime session hosted by Forward Carers, who operate Birmingham Carers Hub for lead carers here in Birmingham. I'm joined here by my colleague, Alison Brinkworth from the Census team, and she can introduce herself a little bit more in a second. Just to let you know that this meeting or this session is being recorded, so we can share it with carers that weren't able to join us today. There is a question and answer if you've got any questions, and obviously we can pick them up towards the end of the session. So without further ado, I'm going to hand over to Alison just to introduce yourself and get us going. Okay, Alison, over to you.
Hi everybody, yes, I'm the Census Engagement Manager for South Birmingham, so it's really great to talk to you all today. I think we've got a little poll to start off with, and then I'm going to talk to you more about what the census is, because you're all going to start getting letters like this through the post if you haven't already, and it's nothing to be frightened of. It's something that's going to actually help you. I'm going to talk about how, and also help available if you haven't got the internet or you're don't feel that confident about filling in forms, and also show you how you can do it as well online. So Dion, did you want to do the poll first before we get started?
Yeah, let's go to the poll first. So everybody can vote. This is completely anonymous. Obviously we won't know who's doing it. So everybody have a go, including our colleagues for Forward Carers here on the chat as well. So here's the first question. So true or false about the census? You can only, or I can only fill in the census form on the census day, which is on Sunday, the 21st of March. So I'm just going to show that for you now. So you should be able to see that on your screen now. Have a go. We'll give it a few more seconds. Okay, I'm going to end the poll now. So here are the results. So Alison, can you tell us a bit more about that? So is it true or false? You can only fill in the form on census day.
It's false. So I'm really impressed with everybody out there for knowing that. Yeah, it's based on, you give your answers based on census day, but you can fill it in before, you can do it as soon as you get your code and your letter in the post, or you can actually, we do give people sort of weeks after census day, because we know people are busy or they might have other things happening, and you will get reminders, but you do have into April as well. And actually the real cutoff date is the end of April, but I'd say get it done before then, because if not, you might get people coming to sort of knock on the door just to ask if you need help. So yeah, the earlier the better.
Okay, right, let's go to question 2. Okay, question 2. I must complete the census by law. So let's all have a go at that one. Got a few seconds. Everybody to get involved. 5, 4, 3, 2, 1. Okay, we're going to end poll now. Alison, what's the answer? Do I have to complete it by law? Yes or no? True or false?
Yes. So again, great bit of knowledge there. Yes, you do. And for those that don't, they face £1,000 fine or a criminal record. So you all know that you have to complete it. Great stuff.
Fantastic. Okay, and then the last poll, the last question we've got here is true or false. There is a question in the census that relates directly to unpaid carers. A few seconds there to complete the poll. 5, 4, 3, 2, 1. Alison, talk us through the answer, please.
Yes, yes, there is, and we'll be talking about that. And you all knew that 100%. So that's great. So and I will be showing you that question and talk around it as well. So that's all wonderful. So the reason that I'm here today is just to let you know that there's lots of help available. It'd be interesting, actually. I don't know if we can do like a show of hands who's sort of done the census before, because it's only every 10 years. So some of you who are younger maybe haven't, but I don't know, Dion, if I can see like if people have raised their hands or not, but yeah, if you haven't, it's understandable because it's only once a decade. And you might have heard of the census because of programs like Who Do You Think You Are and people tracing their family tree. But actually, the real reason behind it is much more important to you, your families, your children, because it's all about planning and investing in the community and to find out what it needs. So that goes down to a hyperlocal level. You could be living in Acox Green, you could live in Erdington, and the results that they get, we take the information from everyone, we make it anonymous, so it's completely confidential, and we just take the figures. So things like how many people are unemployed in an area, how many people carers, unpaid carers, how many sort of ages there are, if there's a lot of people who are going to be in childbearing age, a lot of girls who are going to be maybe giving birth in the next 10 years, then that helps the council and the government plan for midwives and things like that, as well as bus services. It could be doctors, surgeries, it could be schools. So all the information you give is really important on an everyday level. And then in 100 years' time, that's when it's released, and that's when people can trace their family tree. So that's just to put your minds at ease about that. But I am going to share my screen with you now, because I've got a bit of a presentation just to show you that will put some of this in more context, and then I will have time for questions as well, because I know that you might have sort of things that you want to understand in a bit more detail. So hopefully you can see my whole presentation there. So the reason that it's important for all of us is, like I just mentioned, it's all about public services and what's in your area. And this is the only survey of its kind because it's so difficult to do. So it's only every 10 years and it's every single household, and it's anyone who's living in the country for more than 3 months. So it's not just about if you're born here or if you've lived here a long time. It's about anybody who's in England and Wales, because you all need the services, from students to pensioners, to people that are maybe visiting for a year who are relatives. So Census Day is this Sunday. So this is very timely. You'll all be getting letters in the post. You probably have already that look like this. If you haven't received one by in the next few days, then I'd say either phone up the phone line or go on the website to request one, because it's the first time that we're going to be mainly doing it online. Interestingly, it started 200 years ago. And it was one of the reasons why it was first started was they were trying to see how many young men they had to fight in the Napoleonic Wars. But they actually had these men that went round to every house on one day, asking people who were in their household. And of course, a lot of people couldn't read or write then, so they had to do it for them. And traditionally, that's just sort of stayed as the one day every 10 years, but obviously a lot of people now can read and write, they can do the form for themselves, and it's evolved. So this year you can go online, you'll have a code, and I'll show you how to do that later, but not everybody's comfortable online, not everyone has access to it, so you can request paper copies. Some areas might get a paper copy as well in the post if we understand that maybe they're an older population and we sent it them first so that it's easier for them to do. Or there are centres where actually you can phone up or you can visit and they will do it for you. So really we're trying to make it as easy as possible, and there's language lines as well. So there's a lot of help out there. So I think it seems like I've got a bit of a knowledgeable crowd here today, that you seem to understand the census. It's about our society. It's about understanding what people are doing, and that can help us to understand where we need to put money and shape government policy, which we're going to talk about in a minute. And as mentioned in the little poll, it is a legal requirement because it's so important, and they need at least 80% of the country to respond in order for it to be comparable and the data to actually be usable. But we're aiming for over 90%. And actually 10 years ago in Birmingham, we got 91% of people responded. So, you know, people are really on board with this. But because it's a legal requirement, there is a threat of £1,000 fine if you don't do it. So not only the government and councils use this information, but a lot of charities as well, a lot of businesses, because all of the data, the anonymised data, is made public, and you can look at it if you're doing projects, and charities and businesses look at it. And so it can tell them right down to different areas, say how many certain age groups there are, or in this case, how many unpaid carers, and then they can put a business case together and apply for funding and say, well, we know that in Birmingham we have this many people that we need to support, and that happens across the board at a lot of charities, and also a lot of council related sort of third sector organisations as well, because it's the evidence they need which isn't widely available. So by filling in the census, you're helping them as well. In terms of shaping government policy, in the last census in 2011, they actually asked about if you give unpaid care to anyone and how many hours. And the results showed a huge amount of people. In fact, I am going to reveal the Birmingham statistics in a bit. But they were the government was looking to change the Care Act and bring it up to date. And actually, when they saw the extent of the population that were unpaid carers, and sometimes some of them very young as well, they realised that actually that's how they needed to adapt it to cater for people. It wasn't just maybe, people who were in their 30s, 40s, 50s helping older people. They realised it was across the board, and that really helped them with shaping that. So what you fill in can have a lasting effect, not just on the next 10 years, but actually future generations. It also shows the state of the country that we're in. We do make sure that homeless and rough sleepers are counted. This is something that we want everyone to be counted. So this weekend, we'll have specialist teams that actually go to all the hostels, and the council tell us where the homeless are actually being housed. Because of COVID at the moment, it might be a bit easier because a lot of them are in hotels and B&Bs. And so we make sure they're counted as well. And for the first time, there's a new question, which means we'll be able to understand how many people identify as transgender, which has never been done before. So these are just some of the ways that the census helps, things like housing, public health, doctor surgeries, numbers of nurses, things like that. The census data is important, looking at population numbers. So how many people, nurses do you need per that? In terms of going forward as well, like things like education, transport, this is going to be the first census after Brexit and also after the COVID pandemic. So actually the information that we get this time is going to be vital in helping us go forward and planning in such sort of unprecedented times. And it's not the first time the census has been done after a pandemic, because in 1921 it was after the Spanish flu pandemic. So we've actually got form on this. So it's the only thing that has ever stopped the census actually was the Second World War. So it wasn't done then. So the types of questions you can expect in this is about 50 questions. It'll take about 10 minutes. It wants to know about you and your family, where you live, languages you speak. The reasons behind some of that, if it's your address, then that's about when the higher figures, like all the personal details taken out the higher figures, and you can see things like, okay, that local area has these this type of population or this age group, so that's why where you live is important. And languages you speak, things like if there needs to be more translation services in certain languages that helps with that. How you travel, that will help towards, you know, do they need more bus or public transport services or trains in a particular area? If you work, again, that's connected to things like if there is high employment in certain areas, then do they need to have like apprenticeship schemes or more sort of job centres and things like that. Ethnicity and nationality, so again, understand the makeup of the country, and age and occupations. So they're just some of them. Now, the question that's important to carers is this one that says, do you look after or give any help or support to anyone that have long-term physical or mental health conditions or illnesses or problems related to old age? So that question is about unpaid care. So don't count your employment, but actually the extra care that you give and you're not paid for, and you put no or yes on how many hours. And that really gives an indication on how much extra people are having to do because of maybe support isn't available or the time that they give. So in Birmingham, for instance, in the last census, it showed that 10% of people who lived in Birmingham were giving unpaid care to somebody. And that's a massive number. We have just over 1 million people in Birmingham. And there was 107,000, just over 107,000 who said that they were giving care to somebody and it wasn't their job. And so to put that in perspective, about 1 in 10 people are students in Birmingham, which is a really big sort of industry and also sort of group that needs to be counted and their services catered for. So we've got the same amount of people who are giving unpaid care. And I've got the breakdown here. And remember, this was 10 years ago. So actually, potentially, it'll be really interesting to see what happens with that figure. Are there more people now since the Care Act, or is it actually going to stay the same? So it's going to be quite interesting to see the results, but we won't get the results for about a year. So the common age group was the 35 to 49-year-olds, which are around 1/3 of those who said they gave unpaid care, and another 1/3 were in the 50 to 64 age group. So it's most of you are probably in that 35 to 64 age group. But what was interesting as well was there were actually over 2,500 under 16s who said they were giving unpaid care to somebody. And that's really, you know, a large amount of children as well who are doing that for somebody. And in terms of the breakdown with how many hours a week, the majority were less than 19 hours, but there was really quite a large amount who were providing 50 or more hours unpaid care a week. And in total, there were 28,000. So again, that's maybe about a sort of quarter of you providing over 50 hours a week care. And so, you know, that's important to know and for you to be counted and for that to be considered by services and people organising services in Birmingham. So by filling in the census and putting what you do, then if we do need to sort of look at extra services, they can look at these figures and say, okay, this is a large proportion, we need to help out here. So the new questions for 2021, as I mentioned, there's they're both voluntary. It's about sexual orientation and your gender identity. It's only for those aged over 16. And this question means that we'll be able to see how many people identify as not just the sort of traditional gender identities. And like I mentioned about the transgender community, but others as well. And then also if you've ever served in the UK Armed Forces, and that's because a lot of charities for Armed Forces veterans actually were keen to get information on this, so that when people have left the army, they don't always know where they've gone and if they need like extra care and services. And when you join the army, there's a covenant that pledges that that by sort of giving your service to the country will always sort of look after you. So the charities are saying we would really like to know the numbers and where they are, so that we can put on services in those areas and reach them and treat them all fairly and honour that pledge. So that's the reason behind those new questions. If for those of you that are worried about it's a lot of information, who's going to see it? I work for the Office for National Statistics. We're independent from the government. It's all about, you've probably heard our name because we do a lot of things around statistics. There's the COVID figures at the moment that are being done by the ONS. And we also do things like all the employment figures regularly and a lot of the statistics for the country. And so we're used to handling information and protecting it, which is protected by law, and it never gets passed on to anyone. So the government don't see it, immigration services don't see it, anyone dealing with benefits. It literally is just us. It's made anonymous over the next year, and then it's locked away for 100 years, and then it's released. So the 1921 census is about to be released from this year into next year, once that's all sort of being published, and that's when people can actually see who lived in a certain house and the names and the information they gave. So just to put your minds at rest, really, this is purely to help with the sort of planning and to give a shape of society. It's not about finding an individual. So there's a lot of help available for you. We know in Birmingham it's very diverse, so we've got a lot of language lines. There's language guides on the website that can be downloaded, and they explain exactly in a different language what each question is. The census is only in English and Welsh, but there's translations to help people understand, and you can actually phone a language line with a translator, and the number's also on there. That's 0800 587 2021, the language line. And the website census.gov.uk, and that's where you go to actually fill in your census, and I'll show you in a moment what that looks like. We've got census support centres where you can go in, you can book an appointment, go in, or they can do it over the phone for you, or you can go and use a computer and do it yourself. There's a main helpline number for any queries, requesting paper copies, anything you need really, any help. And they can also help you do the census over the phone, and that's 0800 141 2021. And there's a text relay service and other accessibility numbers as well for people who maybe need support in Braille or large print or easy read documents. And the Birmingham team, we're doing lots of virtual drop-in sessions this weekend that I can send on, which I might have already sent on actually, to forward carers that they can share with you if any of you want to join. And we're literally going to be like on a video call like this, and you can just pop in if you need us at any time to ask us if you get any problems. The 15 census support centres across the city, these are going to be open all through April as well, that you can phone and pop into. I'll just put it on there so that if there's one near you, you can jot that down. We've got Sparkhill, Selly Oak, some in the centre, and Digbeth, Northfield, Hall Green, Hitts Green, Shard End, Erdington. Again, I'll send this list over as well that can be shared. There's Aston, Saltley, Wolseley Green, Digbeth, Lizelle. So we've sort of got a real spread across the city that you can go into, and they can help you. So that's sort of the first part. So what I might do is just have a look at some of your questions now before I show you what it's like to actually do the census, and then what you'll face there. So I don't know, Dion, do you want to like...
Yeah. Thank you, Alison, because I think some of these you might have covered already, but we might just want to just check that that everything's been covered. So you just talked about the support available, and you talked particularly about languages. There is a question here about what if the language that my chosen language or household language is not available? Would we be directing people to maybe seek additional support to go to one of the support centres or call the telephone line?
Yeah, I mean, we're covering 50 languages on the website and the translation line as well. And if you have a language, because there's so many languages and we understand that, that isn't covered by there, then phone the translation line, explain which language you need someone in, and they will then be able to try and sort out someone specific to that language. I mean, I don't know if they can say in the chat which language it is, because it might be one that's covered already. But yeah, basically, if you need the help, we'll try and get everything we can to get it.
Thanks, Alison. Okay, so the next question is around, and this obviously might be quite pertinent to obviously the fact that these sessions for carers. Can I fill the form in on behalf of somebody else? And in what circumstances should we should be filling it out, or should we be trying to encourage people to fill it out as far as they can themselves? What are your thoughts on that?
So if you are somebody who's like a trusted carer for somebody else, or they're like a close relative, and you're a trusted sort of person, then yes, you can help them. And you know, they'll have a digital code, and if you wanted to do it over the phone with them, or talk to them or sit with them if you're visiting and looking after them, then yes, that is fine. But obviously, you know, we don't want it open to sort of people to sort of take advantage of that. So we understand a lot of people, it can be even difficult for them to phone the phone line, and if it's easier for you to go through it, then that's fine. But maybe where it's somebody that's more of like, you know them, but you're not that close to them, then yeah, refer them to one of the services that can help them. But if you are a trusted person, then yeah, please go ahead.
That's great, Alison. Our next question is, how do I get a paper copy if I'm unable to fill the census in online? So I know we're really trying to encourage people to fill it in online as much as possible, but if I can't do that, how do I get a paper copy?
And paper copy is just as fine. And we understand that, you know, it's digital is not going to be ideal for everyone. So there's a few ways. If you're not really online at all, then phone that main phone line and request one. If you're okay to a certain extent online, then if you go to the website, I'll show you actually what it looks like. And there is a button that you press to request a paper copy, and it's really prominent on the home page, and you put in your address and your postcode and they will send one out to you. So, and that's quite similar. You could do that on the phone, the tablet, whatever, or get somebody that you trust to do that for you if you can't. But also after Census Day, we will have field teams coming out to check if you've been okay, if you need any support to complete the census, and they're keeping to the COVID like restrictions and everything, and have masks. But you can also ask them to the request or get a paper copy to you as well, if just say those other avenues aren't available.
Thanks, Alison. Okay, the next question we've got is, I think I've lost my letter. Is there another way I can get my code? That's probably be someone like me, actually. You put it down in some paperwork somewhere and now you can't find it. What do I do?
Yeah, so again, the same as the paper copy, there's two ways. If you go onto the website, there is, I guess this happens a lot because there is a thing about request your code again, and the code is what's in the letter. So you just press a button and you put in your address and details, and they will send you out another letter with a code. And again, on the phone line, you could do that as well. And actually on the virtual help things, we can help you with that as well, if just say that you can't, you find it difficult to do things on the internet. So and the census support centres as well. Fantastic. And in fact, sorry, I just remembered on that, they don't even have to send you a letter, because just say you wanted to do it immediately, you can request a new code that they can text you. Oh, so yeah.
Even better. Fantastic. Okay, next question. I live half the time at home and half the time in London. Does it matter? And which address should I put?
So, so with that one, if it is split exactly between the two, then I will double check that actually, because I know that if you're living like with students, for instance, who haven't returned but are normally here in term time. I think I saw a student question pop up as well. Students are being encouraged to make sure they put their term time address, and they'll put their address where they're staying with their family. Because obviously if they're half the time in both, they'll use services for both of those places. So if you're living exactly half the year in both, then it could be that you put both addresses, but I will double check, because it could be that like with holiday homes, and you put your main address, and so I will check that and come back to you. So if you want to give your details to Dion or pass them on, she can pass them on to me, and I'll email you direct about that, about which address or both, but because it's half the time, it might be both.
Okay, thanks. Okay, next question, again, really important, obviously, for our carer community here. So you mentioned and you showed us there's a particular question in there about unpaid carers. But this question says, I don't receive carers allowance. Should I still tick that box that I provide care?
Yeah, because it's about the amount of unpaid care that you're doing. And so relevant of whether you get sort of a carer's allowance or benefits towards that. If you're actually doing that activity, then put it down, because potentially, it might be that you can apply for it or something might change, but actually we want to know whether you are or you aren't. So if you're doing it, then put it down, because that there's probably a lot of people who do it without actually getting the allowance, because maybe they don't realise, or they don't go down those avenues. But I think it's important to say that you do.
I mean, that's a really good point, Alison. And again, something that we see within our service. There are going to be lots of people that are technically eligible for carers allowance, but don't receive it. And that could be for a whole host of reasons. It might affect other benefits that they're entitled to, as you rightly say. They're not actually where they can actually claim it. So from our perspective, you are still an unpaid carer. You receive some benefits towards, that role, but regardless of whether you receive carers allowance or not, by definition, you would still be defined as an unpaid carer. So definitely tick that box. That's great.
And also, because none of this information is cross-checked, it's not passed on to anyone. It doesn't, there's nothing to do with benefits or anything else. So actually, don't feel worried, or if I tick this box, but I don't say that to any sort of authorities or anything, because it's not going anywhere else. It's just purely to understand how many people are doing this.
I'm sure people will be reassured by that. Thank you, Alison. Okay, next question. When will the census results be released? When we find out all this really cool information about, not just about carers, but, just general information about our area. And I suppose a question, a little bit of an add-on for me is that information broken down by area? So you could look at the whole census information, but potentially you could look at it per area as well?
Yeah, and because there's a lot of sort of checking that has to take place. So when the census sort of closes at the end of April, and then there's around a month or so of checking systems where certain field teams are sent out to ask random addresses their answers again, to double check against. There's lots of sort of data protocols and things to check that the data is accurate as much as it can be. And then after that phase, which probably goes through, nearer September, then they have to start to like anonymize everything and put the high level data into like spreadsheets. So it's at least a year. It's probably towards from the middle to the end of 2022 when things start getting released, and it all goes on the ONS website. And there's a website called NOMIS, NOMIS, that's free to everyone, and you can actually look at the 2011 data on there as well already. And there's so much information in there, it can be complicated, and we have teams that can help you, but it will be, you can search by area, you can search by the whole country for England and Wales, and you can break it down to answers for each question. So you can have like the number of carers in Birmingham by sex, by age, by those sort of breakdowns by ethnicity. And that's why asking all these different questions, actually, when they all line up together, it can give you a really good sort of breakdown of exactly who's doing what and things at the moment. So yes, it will be available, but it's sort of the first data comes out after a year, but then obviously there's more drip fed probably over the next year to 18 months.
Thanks, Alison. Okay, I think we've only got a couple more now. So the next question again, I don't feel comfortable disclosing where I am employed. What should I do? Is that, are all the questions mandatory, Alison, I suppose, is a wider question.
Most of them are mandatory, and there's a couple that are voluntary, which will say voluntary. Again, this information isn't shared with anyone, and so really it's sort of like there's nobody that's going to see it until 100 years time. So it's sort of about, at least, you know, you've got your occupation, and it's just like who you're working for, really, to give an idea of like who the biggest employers and things like that. So I don't think that's a voluntary question.
And then a similar or a linked question, Alison, is what if I am employed by 2 different employers? And obviously that's you know, quite prevalent now. People are, you know, taking up you know, part-time work across, you know, more than one role. Which one do they put down?
Yeah, so when you get to the question, it does actually say to put down your occupation and employer as your main, what you'd consider your main job or your main income from. So obviously for some of you, you know, doing a couple of part-time jobs, it'll be your decision in the end which one you put if they're about the same. And that goes as well for, there's a couple of questions where in certain circumstances people might be torn between 2. I think like for nationality, it's what's in your passport, but for some people they have dual nationality, and they will decide which one they want to put because it's one answer. So so some of it on a level is how you identify and what you prefer to put down based on that, but there are lots of sort of help guides next to it, which I'll show you in a moment after these questions.
Thanks, Alison. Okay, last question. This is quite a good one. It links back to the conversation or the talk we had about students. I'm a student, but I am self-isolating or maybe shielding with my mom, who I care for. I'm unable to go back to my accommodation to collect my letter. How can I fill it in from my mom's?
So the universities should be contacting all the students, but I understand if maybe you haven't had an email. So you can go onto the website to request a new code and put in your term time address, and they will give you a code for that. And you can also phone the helpline to talk to them about the fact you're a student and which university, and they can sort out the code. And then also your mom will get, because it's per household, so your mom's address will get a letter, and she should include you on that as well because you're staying there at the moment. And in that, when it gets to you, because it goes through each person in the house, you can put about the unpaid care there. Because I guess when you're away at term time, if you're not doing unpaid care at that point, it wouldn't appear on that one, but it would while you're on your mum's. So it's okay to appear on 2. And when they go through the data, they look at duplications or different circumstances where you're maybe at 2 addresses through the year. But if it helps, just to show you. So if any of you actually, you might have the, I'm just trying to come out of that one and go to this presentation. Some of you might actually have your phone here now and just even look at it with the code, but So this is what the website looks like when you go onto it. And if you just put census in Google, it should come up Census 2021. But this is at the top of the page. So literally you can press the button to start it and put your code in. The bit that says don't have a code, that for those of you that have lost your letter, just click that and then it'll go through asking your address and how you want the code sent to you. And it's census.gov.uk. And there is also on that page about request a paper copy on there as well as a button. And when you start the census, so a box will come up to put your code in like this, and then it'll keep checking along the way. So the next page will be, is this the right address? Because the code will be sort of joined to a certain address. And if it's not, then obviously put no, and then it will sort out getting maybe a new access code for you. And it does sort of give you hints along the way about coronavirus. For instance, if you're on furlough, then the answers you give, such as there's questions about how you travel to work, because that helps to know, like, say the levels of bus services or train services in rush hour and things like that they need to put on. But if you're on furlough, answer it as though you're still commuting because you're still employed by that job. If you aren't on furlough but COVID has changed your circumstances and you're now working from home in that job, then answer it as things are now, because furlough is slightly different. That job's sort of being suspended, but you're still being paid for it and should be going back to that when this ends. So it'll ask things like how many people are in the household, and it sort of explains what it means by the household. So it says about if there's visitors staying overnight on the 21st. I mean, this year more than any, it's probably easier to fill it in advance relating to what will happen on the 21st, because with COVID it means there's restrictions and most of us are in the same circumstances we will be on Sunday. And so it sort of says, do you usually live here, or if you don't? So for some of those people who have different addresses, that will sort of take you through and you can put your answers in. Then you put like what sorts of people, like if it's family or relatives, or just rush through some of these to get to the ones that might be sort of more interest. And there you can put about people who are temporarily away, and it sort of explains about if people are out of the country for 6 months or 12 months, or people who are here on holiday. So it does sort of help you along the way. And then just trying to get to some of the new questions. It's got about marriage, about if you're a student, so that will the person who's a student, that will be there. With national identity, this is one that's not everyone just falls under those main categories, and so other will be used by quite a lot of people. If you feel that your national identity is not on there, then you can add it in other. So feel free to do that. You don't just have to do those boxes, because it's how you feel about your own identity. And there's ethnic groups. Again, languages, if British Sign Language as well, or other, put that in as well, because it helps. In fact, it helps businesses as well, because for a lot of supermarkets, when they're planning to open ones, and they'll look at things like areas and the sort of high level data, and they'll be saying like, okay, they're populations with a lot of families, or if they've got a large population who speak different languages, or they're different identities and cultures, and so they might have certain aisles that have different types of food, or translations and things. So actually it sort of goes beyond just the general public services. And there's questions around health, and like we looked at this one about giving long-time care, unpaid care to anyone. And this is when you get a question that's voluntary, it will say, as it does here, this question is voluntary. So these are the ones you don't have to answer. With the ones that aren't voluntary, you can't go on to the next page on the website until you've put an answer. But on the ones that are voluntary, it will just let you continue without filling it in if you don't wish to answer that. And these are the ones about employment, and it does say about your main job. So it's the one that you work the most hours that you're actually told to put in. And then the only other thing is to say, when you get to the end, because when you'll do one, and then like, because it asks you who's living in that household. So you say you have like 4 different people, and then once you've completed all of them, you have to press the big green submit census for it actually to go through. And then once that's in, then it's all completed and you don't have to worry about it anymore. So I don't know if there's any questions on those.
That's great, Alison, thank you so much. I think we've answered all the questions now, and we're just about run out of time. So just wanted to thank you so much, Alison. I'm sure people would find this really, really helpful, and obviously we're sharing this online after the live session as well. So thank you very much. And obviously we have, we'll be posting details about the follow-up session that we're also hosting if particular carers want some support directly with filling in their census. So just want to take this opportunity to thank you again, and also to thank Bernie and Georgina who are on the call as well, providing support with the questions from Forward Carers. Thank you very much, everybody. Enjoy the rest of your day, and we'll see you soon. Bye-bye.
Bye.